I'm Dr. Blissenbach, and I'm with Blissful Wellness Medical Weight Loss Centers. What makes our diet plans and our weight loss centers different than others that are out there today is that we are medically supervised. There is no question that with the type of patients that are out there today, the amount of diabetes, heart disease, hypertension, infertility, joint destruction, all caused by the epidemic of 75% of our population being overweight, that it is the role of a physician and the medical community to get this under control. Other centers that are out there are not monitoring your diabetes. They are not doing your labs ahead of time. They are not watching your EKGs. They are not making sure that all of your medical problems are addressed when you do their diets. They don't know what medications you're taking, if things are going to interact, how to alter them as we go through the diets and people are losing weight. So as a physician, I feel it is my obligation and the obligation of all my centers to follow certain protocols and to do the best by our patients. Not many other centers that are not medically oriented out there can claim that. So it is a much safer situation to do your diet, especially one where you're going to lose weight fairly quickly, in a safe, effective manner, monitored by a physician. Our programs allow all of our providers to be in direct contact with your provider, with your doctor, so that if anything changes or we notice that there are any problems on your labs or throughout the diet, that you are getting direct attention immediately and we are directing you back towards your physicians. If you've got a blood pressure issue, I can deal with that on site, and then we can call your physician, make a one-on-one contact. Letters are sent to all the physicians if there are any abnormalities on our labs and our EKGs, so that the providers and their primary care doctors are integrally involved in their weight loss experience. All of our diets are very medically sound. They provide more than enough protein to the patient so that we keep their metabolisms intact, so that they don't get hungry and so that they don't get into trouble with dehydration. We instruct them and give them huge amounts of information so that they know exactly what to expect if there are any side effects or how to contact us. I am on call 24 hours a day in case the patients get into any kind of troubles or have any questions. And our provider sees our patients at the beginning of our diets, in the middle of our diets, and at the end of our diets. And I get involved anytime I have to if there are any issues that the patients have, any concerns that they have. I've spoken to doctors on the phone if they need me to, in order to help them prepare their patients for the diets and get through them very smoothly. That is one of the huge benefits to doing a medically oriented and a medical diet, which most of the other centers out there cannot claim. Please come visit us at GetSkinnyJacks.com, and please feel free to like us on Facebook.